ni siquiera respiró, ¿no?
Sí, no respiró.
¿Y el de acá es mujer o es hombre?
Mujer.
Mujer. ¿De repente su bebé?
No sé.
No sabemos si es totalmente humano. Pero el cráneo, ¿no? Es tan inusual, ¿no?
Sí.
Y el tamaño de la cara, que es tan pequeñita, y el cráneo gigante.
¿Varoncito o mujercita?
No sé.
¿No se puede ver?
Sí, no.
Varoncito.
Ah,
Esta de Elongated se llama. Por ahí va teniendo un traje.
Pilas, a ver, voy a ver si
So we're here with Dr. Ken, and can you make some comments, please, about what it is that the viewers are looking at?
We're looking at a skeletal structure, and based on the pelvic bones is likely a female. Based on the size of the humerus and the size of the femur, we're looking at someone that may be 5 feet to 5 feet 4 inches in height. Based on the degeneration of the bony structures and lack of degeneration of the bony structures, this is a very young individual, likely 20 years of age, plus or minus 5. Younger than that, actually. As you take a look at the teeth structure here, we're looking at teeth, and then we're looking at teeth that are underneath it, still within the maxilla. So we're looking at teeth that have not come out yet. So the teeth that are exposed are the baby teeth. So that puts this as a younger child. So we are looking at a child.
So how old would you estimate based on the teeth?
Based on the teeth, you're looking at between 8 and 12 years old.
Wow.
So, again, looking at the skull, looking at the orbital features, you've got the sutures along the orbital floor which haven't quite fused, which goes along with a young individual, but their orbital apex has a single hole, which goes along with more for normal orbits, normal globes, normal eye socket, or normal eyes. The anterior fontanelle is posteriorly displaced, approximately 7 centimeters from normal. The sagittal structures are normal. There are no extra sagittal sutures. So we are looking at a human being with a variant skull.
And based on your medical expertise, you do not think this is the result of cranial deformation or head binding?
Definitely not. If you look at the bowing of the frontal bone, it's not flattened, so it's unlikely that this is the result of cranial deformation.
So it is quite possible that this individual was born with this elongated
Yes,
head.
this individual was born with a skull structure exactly like this. This skull is different than that of the skulls in Paracas because the occipital bone is not protruding posteriorly as the Paracas skull has got. And also there are no extra sutures along the posterior aspect.
So Ken, based on what you've seen of the larger skeleton that is in the glass case, what can you tell us about it?
I believe it's a young female who didn't die from trauma, and based on the skull, there certainly are a lot of human features, but it has an elongated skull, and so the question is that a genetic variant, or is that something that is non-human? And the answer is I don't know. But it certainly is a young female.
And what age would you estimate?
I would estimate between 8 and 12 years of age. Most of the teeth have erupted, and those are permanent teeth that you're looking at, but there is one tooth on the right that still has a unerupted tooth yet. So you're looking at an older child.
Of 8 to
12, 8 to 12 years of age.
So you heard it, not just from a physician, not just from an anatomy expert, but from an American-trained radiologist that What he was looking at was a child with an elongated head. He stated that he believes that the child was born with that elongated head, and he also believes that it has mainly human characteristics, but the skull itself is not that of a Homo sapiens sapiens, most likely. So the next question is, who was it?
However, the cause of death is not trauma.
Okay.